Hello, friends and colleagues. You have expressed a great deal of interest in talking about GABA, and I agree with you. We should talk about the therapeutic potential of that particular neurotransmitter. And there are many, many opportunities that await us. But we should also talk about the potential downside of GABAergic molecules and interventions. So this video is for you. GABA is a wildly interesting and a very hardworking neurotransmitter in the human brain, and there's simply no doubt that it will have great value in helping many patients with a variety of psychiatric conditions. But there's also no doubt that there is a dark side to GABA, and here are four examples: roofies, GHB, and of course alcohol, and needless to say, the benzodiazepine pandemic that's affecting us currently. So, what are roofies? So, roofies are, of course, a colloquial term to talk about a set of benzodiazepines that are often used in date rape situations. And GHB, which is also a GABAergic medication, has been used as a drug of abuse. Now, what about GABA A receptor modulating medications for sleep? So, of the top 10 most prescribed drugs in America, how interesting, four of them appear to be GABAergic medications. And of course, alcohol. We should not forget that GABA, in turn, is involved significantly as well as the chronic effects of alcohol. And GABA can become quite addicting in some patients, or it can actually increase the amount of dopamine produced, and that itself causes a great deal of challenges for our patients. So, GABA can actually lead an individual on to difficulties. So while we are genuinely appreciating that GABA does have a great deal of positives and it's worthy of respect, minimizing challenges from it from a clinical perspective is a very important clinical mandate. In the future episodes, I'll talk much more about GABA and its therapeutic use, but at the same time, let's appreciate that GABA can also have a dark side, and it's our job as clinicians and as utilizers of therapies to minimize the risks and to increase the productivity from GABA. But in conclusion, I would say GABA is indeed the hardest working neurotransmitter I know in the human brain. And the more we learn about it, the better off we are. I will see you next time. Thank you for listening.